Good evening, everyone. I'd like to welcome everyone to this event that has been organized by the My IVF Answers platform and the European Fertility Society. It's a great organization that has been created to educate and bring awareness to patients suffering from fertility issues. I'd like to introduce myself. My name is Chrysa Costa. I'm a clinical embryologist, have been in the field of IVF for the past nearly 28, 29 years. And in the last 10 years, I head the international department at NewLife IVF Greece. Before I start my presentation regarding egg donation at NewLife IVF Greece, the cost, the processes, I'd like to tell you a little bit about NewLife IVF Greece and why an embryologist heads the international department. NewLife started as a clinic around 15 years ago by a couple of passionate people, two gynecologists and two embryologists, that their passion was to bring the best services to patients suffering from fertility issues, but also to educate them, to help them. We're always not going to be the best choice for every single couple, but we like people to know what we offer, to offer transparent processes and hopefully help them along their journey. So I will explain that I started this role as the International Patient Manager Director because we started to see that more and more patients from abroad started to choose NewLife as their clinic. And we thought that my role as an experienced embryologist would help support, guide patients, and help the coordinators be able to support patients throughout their journey. I will start today's presentation, but before I start everything, I'd like to explain that the whole presentation is anonymous. Your names will not be published anywhere. Any questions that you may ask following my presentation, no one will be able to see your name, so please feel free to type in questions, and following my presentation, I will reply to them. The whole event will be recorded and will be published on the My IVF Answers platform on YouTube. So if you have any issues with this, please at this moment depart from the presentation. I'll be starting with the presentation. As I said, today's presentation is egg donation costs and process at NewLife IVF Greece. I'd like to start off by saying what type of treatments are permitted in Greece and who can have such treatments. Treatments are allowed for married couples, unmarried couples, and also for single women and same-sex couple women. I like to always explain this because in certain countries, single women are not allowed to have treatment, same-sex couple women are not allowed to have treatment. In Greece, the legislation is quite liberal, so we're allowed to offer treatment to all these types of couples or individuals. But for couples that are not married, we need to sign what's called a notarial deed. This is something, an official paperwork that we organize here at our premises, so patients don't have to run around finding or seeking other places to sign this paperwork. When people arrive for treatment in our country, we will organize it at our premises. A big change occurred in July 2022, and we started to be able to offer treatment to women over the age of 54. Indeed, special permission is required from the Greek National Authority of Assisted Reproduction, which is the Greek HFEA, for women over 50. Again, if we have a woman that's over 50, we help as much as we can to get all the necessary paperwork that we need to get in order to apply for this permission. And it's basically an examination from a cardiologist, a breast specialist, and a gynecologist, so we can ensure that women over 50 are safe medically to be able to proceed to such treatments. Another big change that occurred in July 2022 is that egg donation changed from simply being anonymous, non-ID release, to also eponymous. So basically, we can offer both anonymous egg donors and eponymous egg donors. The same applies to sperm donation if we're utilizing sperm donation. As you'll see, we offer both such services at NewLife, but because the law changed only fairly recently, you need to understand such big changes need to be accepted by also the population, the Greek population. And therefore, in the anonymous egg donation services that we offer, we as NewLife recruit and test the egg donors here locally. NewLife's egg donation matching team will select the donor based on your characteristics, your requirements, your blood groups, and we will use fresh donor eggs. This means that once we select a donor for you, we will either have a husband's sample stored here in order for us to be able to utilize on the day of her egg collection, or we will actually have someone fly in to freeze a sample beforehand so we can utilize that sperm. If we're using, of course, a sperm donor, again, the sperm will already be stored in our premises so we can utilize on the day of the donor's egg collection. With eponymous egg donation, as still, it's not something that's widely accepted by the Greek population. We had to find ways in order to be able to offer that because we do treat patients from over 77 countries in the world. And we do have many, many requests for open ID egg donation donors. We have started to work with specific egg banks that recruit and test the egg donors. You select yourselves the egg donor, and we then have the eggs that you've selected shipped in to our clinic where we do the fertilization. But as you understand, in the anonymous egg group, we're using fresh donor eggs. In the eponymous egg donation group, we're using frozen donor eggs. Success rates. Now, success rates have to do with how many embryos we also transfer. In Greece, we're permitted to either transfer 2 embryos at a time or 1 embryo at a time. If we're using 2 embryos, we see a positive pregnancy rate of around 68 to 70%, with a live birth rate that comes up to around 54%. And however, in that case, we do have a twin rate. So women that achieve a pregnancy when transferring 2 embryos, around 20% of those women will deliver twins. To some, this may sound like a very happy event, but we need to point out that twin pregnancies carry higher risks of miscarriage, higher risks of developing gestational diabetes, higher risks of having preeclampsia at the end of a pregnancy. So in many cases, we sometimes have to suggest a single embryo transfer, or electively patients select to have single embryo transfers to play it safe. In those cases, the chance of a positive pregnancy test is at 50%, and the chances of a live birth is around 38%. But these success rates are per transfer. I point this out because IVF, whether it's with own eggs or with egg donation, is a numbers game. So we always look at cumulative pregnancy rates as well. So if a first transfer fails and we go into a second transfer, we achieve the same results as a double embryo transfer. If we have surplus more embryos that we can transfer a 3rd embryo or a 4th embryo, then these chances increase. At NewLife, we've seen that when we create 4 to 5 embryos of top quality, because that's what we guarantee as a clinic, we manage to achieve live birth rates that are in the range of nearly 85-90%. We're talking about live birth rates. However, many patients do achieve the pregnancy from the very first transfer, and remaining embryos are there for a potential second baby, for a sibling pregnancy. So, are there differences in success rates between fresh and frozen eggs and in the way that we offer it with anonymous and eponymous egg donation? Indeed, we do see a 10 to 12% lower chance with frozen eggs, but not because embryos are worse or not as good quality, but because we usually create smaller numbers of embryos when we're utilizing frozen donor eggs. For example, just so you understand this, if we have 10 fresh eggs and we utilize the same sperm, or 10 frozen eggs, from the 10 fresh eggs, we're anticipating, if the sperm works well, to get 3, 4, 5 blastocysts. From the frozen eggs, we may end up having 1 or 2 blastocysts. So you understand, because of what I explained earlier, the cumulative pregnancy rates, that we end up getting this 10 to 12% lower chance when using frozen donor eggs. A solution, because we do have many women that insist on using eponymous egg donation, is to purchase a larger number of eggs so we can create more embryos and hence reach similar success rates. Now, another big question that I get asked, because with anonymous egg donation, we're recruiting the donors, we're doing the testing. Does the same apply when we're buying eggs in from egg banks? Indeed, we collaborate with specific egg banks, and indeed, we perform similar, or we receive similar blood tests from the egg banks that we work with. We are very transparent on the types of testing that we perform. There are the simple tests like blood group, the hepatitis B, C, HIV, syphilis, CMV, screening for genital tract infections. Obviously, because we're of Greek Mediterranean origin, we do testing for beta thalassemia, for sickle cell tests. There are more prevalent conditions in the Greek population. But also, apart from these more simple tests, we also do genetic testing for the chromosomes. So we ensure that their karyotype tests are normal. We check for Fragile X. We check for cystic fibrosis, spinal muscular atrophy, non-syndromic deafness. And just before the donors egg collection, we again repeat what are called NAT tests for Hep B, Hep C, and HIV to ensure that there isn't something that has been missed during the preliminary tests. The donors all go through psychological assessments to ensure that mentally they're okay to go through this process, and that the psychologist of the IVF unit does not pick up something that we need to sort of clarify further. We put the donors through multiple cross questionnaires to confirm personal and family medical history. And we also put them through a questionnaire to reveal any possible genetic diseases in their family. Unfortunately, in the anonymous egg donor group, we do not have access to their family medical records. So therefore, this is the reason why all these cross questionnaires and sort of genetic sort of questionnaires are performed by us. So we ensure that apart from the things that we're testing, we can figure out things that we can gain from their family medical histories. Now, patients have asked me, but I'm going to be selecting an egg donor from an egg bank and they're not of Greek origin. Do they need to do extra tests? Each egg bank will perform extra testing if a specific donor belongs in a different population and they need to test for something specific. So they're aware of these things. But of course, if at any point you're using an egg bank and you have any queries or worries, the collaborating egg banks that we have offer free consultations, so you can ask them more questions, clarify things, and ensure that before you select that avenue, you're totally happy with what is going on. Now, one of the things that is very, very important is cost. And obviously, we need to start comparing costs, because a lot of people see these differences and think, wow, eponymous frozen donor eggs is much cheaper than anonymous fresh donor eggs. This is the route I will select. I need to explain what's included in these costs, what's included in these costs. And also, you need to always, when speaking to clinics, do your homework and understand fully when a package is presented to you, what is included in this package. With anonymous fresh donor eggs, we offer as a clinic 2 packages. These packages do not guarantee a specific number of eggs, but we go on to guarantee a specific number of blastocysts. In the standard egg donation package that we have put a cost at 7,350 euros. We guarantee at least the creation of 2 top quality blastocysts. This means if you create 3 or 4 or 5, of course these embryos are yours and we will store them for future use. With the advanced egg donation package, the cost is 10,550 euros, not 55, sorry. We guarantee at least the creation of 4 top quality blastocysts. But again, many times with the advanced package, we may create 5, 6, or 7 embryos. These embryos are yours and they will be stored for future use. Now, with eponymous frozen donor eggs, the NewLife cost is 3,140 euros. However, you need to remember that on top of this cost, you need to add the cost of how many eggs you purchase from each egg bank, and the costs differ. So this is something that you need to clarify before sort of being able to calculate the total cost, and also the shipping of the eggs from the egg bank to our clinic. We're happy to help, and each additional patient that has a video call consultation with our team receives more information regarding the egg banks that we collaborate with, and costs and sort of links so you can contact them directly. Additional costs that we always should make aware: embryo freezing. If a patient creates 4, 5, 6 blastocysts, we do have costs per straws in order to sort of be able to cryopreserve those embryos. Medications. Indeed, the medications that we utilize to have transfers or frozen embryo transfers are not as high as the medications that we use when we're dealing with own egg treatment cycles. But again, it is a cost that you need to account for. Preliminary blood testing. Preliminary blood testing is something that all IVF centers worldwide require. You can have these with your doctor on the NHS if you're in the UK. You can have them in your own home country, or you can have them here with us, because many patients that you'll see later on in my presentation perform preliminary visits, and also travel and accommodation. Logistics. I want to point out that logistics are very specific, case by case. Anonymous or eponymous donations have different timeframes, different logistics, but each individual case, also we look at them individually, and based on their personal needs, we may sometimes change the logistics. Most patients with the anonymous fresh egg donations will come and visit us, have this preliminary 2-day visit. During this preliminary 2-day visit, we will perform a mid-cycle scan so the doctor can assess properly the endometrial lining, discuss about findings, medications, sort of issues, whether we should do a double transfer, a single transfer. We then see a sperm sample and cryopreserve ampules of sperm so we can utilize when we find the suitable donor. We have a very long conversation about what are the main things that we should focus on finding the specific egg donor for you. And you also get to meet us, because with anonymous fresh egg donation cycles, you need to trust the clinic. You need to trust us, because we're going to be selecting the donor for you. Once we find the actual donor, we go on to pre-create these embryos and store them for you. Treatment can start in your own home countries. A couple of scans will be required. Of course, we will review, we will give you instructions, and only the female partner needs to fly in for a one-night stay to perform the embryo transfer. Our treatments don't end with embryo transfer. We're there, and sometimes we're there until people deliver. So although we say embryo transfer and it's the end, it's not the end. We do sometimes have males travel first and then females travel just for the transfer, both one-night stays. We do sometimes perform synchronized treatment cycles with the egg donor with a longer length of stay. Success rates are the same, no matter which way we run these cycles. The logistics differ from which country people are flying in, what their personal needs are, the risks that they want to take. Everything is discussed in a lot of detail. Eponymous frozen donor eggs. Most patients will fly in together when we're due to thaw the eggs and create the embryos, and after the female partner has prepared her lining so we can perform a transfer. And their stay is usually for 7 days. But sometimes if donor sperm is used, or the male partner has cryopreserved a sample at our clinic at a prior time, the female just needs to fly in again for a one-night stay. Generally, what I'd like to say, and the take-home message before I open the floor to questions from you: egg donation is a very straightforward treatment with very high success rates. At our clinic, we offer all options: anonymous, known, fresh, frozen. Our expert team, our very high-end laboratory, our personalized approach will ensure that you receive the highest possible treatment. And also, I want to speak about my team a bit, the international team. It was created because we wanted to have their best friend along the way, to take them by the hand explain to them where they'll do tests, when they need to fly, how they take their medications, and support them throughout. I think it's one of the big strong points of NewLife, and at least this is the what I receive when I have reviews. Everything you need, all in one place. We're here to support you, and we're here to help you. All you need to do is just tell us your story, and we're going to be here for you. Now, I have a few frequently asked questions, but I see that people are already starting to ask questions. So let me start replying to a few questions, and then if I see gaps, I will get to the frequently asked questions. TR, you ask me, excuse me, do you have any Japanese egg donors? I'm afraid we do not. Not in the anonymous fresh egg donation sort of services that we offer. Indeed, sometimes the egg banks that we work with may offer Japanese Asian donors, but I need to point out that the Asian population is not very open to donations. I'm not saying as a recipient, but also as a donor. We've approached here in Greece various minorities, either Asian or Black African, in order to see if they'd be willing to donate eggs. And we always have had negative replies, but also speaking to various other sort of colleagues in different IVF units, I think it's a problem. Not many Asians do become donors. So I'm afraid on that one, I can't help. All we can do is try, if you wish, to match the rest of your sort of characteristics to an egg donor that is of a Caucasian descent. What is the timeline to get an egg donor is YY's sort of question. If we're talking about anonymous egg donation, it can take from a few weeks to a couple of months. The maximum usually it takes us 3 to 4 months in order for us to find a donor that matches the characteristics that we're wanting. Obviously, this depends on what characteristics you request, your blood groups, if you have specific requirements. And what about embryo donation? The question carries on. When we're talking about embryo donation, we need to clarify what you mean about embryo donation. Embryo donation could be pre-created embryos that clinics offer, or that we go on to create embryos from an egg donor and a sperm donor that you either select or we select in the anonymous egg donation group. If we're talking about creating embryos, the first step is for you to select a sperm donor that you're happy with from the sperm banks that we collaborate with. This is shipped to our clinic. If we're using anonymous egg donation, we start the process of trying to find a donor that matches you. Again, anything from a couple of weeks to up to 3 to 4 months, depending on your characteristics. With frozen donor eggs, the timeframes are faster because everything depends on how fast you select the egg and sperm donor from the egg and sperm bank that we collaborate with. Now, as a clinic, we don't offer ready-made embryos a lot because we don't believe in sort of offering ready-made embryos left over from patients, because these patients may have suffered from IVF themselves, from any issue themselves. And you need to remember that if these embryos are left over from IVF patients, they may have not performed all the tests that I mentioned earlier. Let me get to the frequently asked questions that I have until further questions arrive. What type of medications are typically involved in egg donation treatment cycles? If we're preparing the body for a transfer, there's 3 ways of doing this. In a natural cycle, where literally we don't take many meds, we just follow a natural cycle. A medicated cycle where we use just estrogen and progesterone. And there's other types of medications that we use in cases where we have specific conditions like adenomyosis, where we need to downregulate the body with specific injections. I've got Monique that's asking me a question. Sorry, M that's asking me a question. What's the name of the egg banks you work with? At the moment, we are working with Chrysa International. We're working with Ovoria, a Ukraine clinic, and we're working with a clinic based in Cyprus called Aphrodite. We've chosen these 3 egg banks because they offer a wide variety of different ethnicities of egg donors. But we're also discussing expanding this egg donor bank network. But we always need to trust the clinics that we work with and sort of need to do our investigations regarding the quality of the eggs, whether the tests they perform are proper, because we always want to abide by the Greek and European authorities. I've got a question by CM. I have a surrogate. Do you offer treatment with sperm and egg donor to surrogates? Indeed, we are happy if we can get the appropriate license for your surrogate to create eggs and create embryos from egg and sperm donation in order to implant these in your surrogate. In Greece, in order for us to be able to move forward with a surrogate treatment, we need to get a specific approval from a court order. This is quite a complicated process, but again, we do have lawyers that can help with this in order for us to get the approval, and then we can move forward in transferring the embryos in a surrogate. I will carry on with another question by MM. Is ICSI standard practice for fertilizing donor eggs? Indeed, in our clinic, it is something we strongly recommend. The reason being is that the whole purpose is to try and achieve maximum fertilization. Sometimes, even with donor eggs, we may get suboptimal fertilization if the sperm doesn't have the ability to properly fertilize the eggs. At this point, what we're wanting to do is create the maximum number of embryos. ICSI has not been associated with an increased risk of chromosomal abnormalities due to the technique, but mainly due to the sperm that's used. So hence why we'd like to try and maximize fertilization by using it. I've got another question by M. Is it allowed to ship the embryos to other countries? From our part, the embryos that we create belong to you. And this means that you are allowed to ship them to a different IVF clinic within Greece and abroad, but you need to always ask the other clinic abroad whether they're happy to accept the specific embryos. And when I say whether they're happy to accept the specific embryos, for example, if you're wishing to ship these embryos to a country that does not allow anonymous egg donation, then they may not accept embryos that we've created through an anonymous egg donor. So always you need to ask the receiving clinic what their requirements is. But of course, if you have the approval, we're happy to help. There are specific courier services that we can utilize to safely get your embryos to whichever clinic or country you wish them to be transferred to. CM, you're replying, thanks. Regarding surrogate, share your details after the meeting, please. Yes, I will share details at the end of the meeting, so you guys can contact us if you wish to start communication with our clinic. A question. Also, do you typically recommend single embryo transfers for donor egg cycles? I'm smiling because I have the image of our doctors whenever I get asked this question. And because they are also obstetricians, if they could recommend to every single woman having a transfer to do a single transfer, they would recommend this. Why? Because it's a safer option. Remember, if we created 4 embryos and they're perfect, whether a patient does single embryo transfers, 4 embryo transfers, or whether they have a mad doctor and they transfer all 4, if they were meant to have 1 children or 2 children, they will get the same number of children. By doing single embryo transfers, we do not take risks of having multiple pregnancies, twin pregnancies, and this reduces the risks. But again, if you're healthy, do not have any underlying medical conditions, and the doctor sees it fit that you can have a double embryo transfer, this will be discussed with you along with all the sort of issues that may arise with a twin pregnancy if this occurs. I can see someone typing another question. It is by M. Is it allowed for same-sex couple to bring in your own sperm donor, as in send in frozen straws? When you mean your own sperm donor, if you mean someone known, meaning a friend, this friend would need to go through all the testing and a very long process in order for them to be approved as a sperm donor. If you mean that purchasing from a sperm bank, yes, you're allowed to purchase sperm from a sperm bank. We don't have our own sperm donors here at NewLife. We work with specific sperm banks. If you'd like to clarify what you mean by your own sperm donor, I can elaborate more if you'd like me to. You can see someone's typing. Let me give. Are there any, I've got MM asking, are there any potential hidden or unexpected costs that might arise during the process? From the presentation, as I explained to you, all the costs that we have are always transparent. The extra costs are preliminary blood tests, embryo freezing, medications, accommodation, travel. Hidden costs that may arise, I wouldn't call them hidden. I would call them things that come up last minute. For example, if during a preliminary visit, the doctor identifies an issue with the endometrial cavity, we have a polyp, we see a condition that someone needs to have a procedure, a hysteroscopy, then indeed this may be something added on. But in these situations, we don't necessarily say, come on, let's do it now. We give you the option to go back home on the NHS to have this treatment done, this examination back home. We're not a clinic that generally likes to pile on, add on a lot of things. And generally, we're not a clinic that will recommend unnecessary investigations and tests. I know that we have had many patients contact us after being in touch with other clinics in Greece saying, I've been asked to do a hysteroscopy before even starting treatment. I've been asked to take months of medications before even starting treatment, sperm improvement protocols. Are these things that you're going to ask us to do? Try and understand our recommendations are very individualized. Each case is dealt with in a very specific way. The doctors will read your history, will ask you questions, will identify issues, and will only recommend either investigations or medications if they are required. Not everyone takes the same types of treatment. Just to answer a few of the frequently asked questions that I have, that people ask me a lot of the time, that you may sort of wonder about. Can I have treatment without having a period? The lovely thing about egg donation treatment is that you can have the same success rates no matter when you have such treatment and no matter what your menstrual status is. So your age does not play a role in the outcome of treatment. Whether you're 20, 30, 40, 50, and you have egg donation, the success rates are the same as long as the egg donor is selected and the embryos are prepared in a proper way, and as long as your endometrial lining meets the proper criteria and we schedule transfer in a correct way. If a woman is in a menstrual, does not have a menstrual bleed, we can induce a menstruation and we place them on what's called an HRT regime, a hormonal replacement treatment regime, in order to bring back these cycles. And after a couple of months, the uterus gets back into shape, because when we're lacking periods, the uterus goes atrophic. And once this time frame passes, we prepare the body and we're able to move forward with an embryo transfer with the same success rates. How are egg donors screened and matched with recipients? We said earlier about the screening processes and all the blood tests that we do. Indeed, for specific cases, we may put the donor under more testing if we identify something, for example, in a male partner. He's a carrier of a specific disease, disorder, mutation. we then may test a donor for the specific issue. So we have no issues when we try and fertilize the eggs with the specific sperm. And how do we match the recipients? We obviously use all the phenotypic characteristics that they have when we try and identify a woman that has similar features. But we also listen to you, because we do have patients that the phenotypic characteristics is not their main focus. They want us to focus on sometimes education, sometimes on specific traits, sometimes on nothing, just the health of the specific donor. These are things that we will discuss with you, and we will identify what is important for you. Finally, from my end, what happens if my donor does not have many eggs after the egg collection? This is the point that I pointed out, that as a clinic, we don't guarantee a specific number of eggs. We guarantee blastocysts. If anything goes wrong in the specific treatment that we run for you, we as a clinic guarantee that we will run either a new treatment on the specific donor or a different donor completely, in order to meet the guarantees that you've signed up for. So when we say that with a standard package, we guarantee at least the creation of 2 top quality blastocysts, you will have this at the end. If for any reason, for example, with an advanced package, we only end up having 3 embryos, after 1 or 2 months, we will maybe run the same donor treatment, the same donor under a new treatment, to create more embryos for you. And in the end, you may end up even having more embryos. We have a question by YY. Top quality blastocysts means PGT tested or grading? Graded. So we're talking about day 5, top quality AA blastocysts or max or minimum AB blastocysts. In Greece, PGTA testing is not permitted in donor-derived embryos unless the male partner suffers from a specific issue, has an abnormal karyotype, and we need to test the embryos. But alternatively, we're not permitted to perform genetic testing on embryos derived from donor eggs. And to be honest with you, as a scientist, I wouldn't suggest it. Genetic abnormalities occur mainly due to 2 reasons. One is inherited conditions. We're going to be testing the donor. They're going to have clear karyotypes. So we're not anticipating sort of any issues. But also due to the age, the female age. And with donor eggs, we're anticipating a 20%, maximum 23% of random abnormalities based on age. Simply by creating more embryos, we bypass these issues. And we need to remember that PGTA testing, although is a great technique, it does have certain disadvantages. The actual process isn't, the biopsy process is an invasive process and may even damage embryos. So it shouldn't be done lightly on all cases. The Greek law is very specific on which cases are allowed to perform genetic testing, even with own egg treatment cycles. And this is to protect patients from doing unnecessary treatments on their embryos. I hope that answers your question, why, but I'm happy to elaborate if you'd like further clarifications. I can see someone is typing in further questions. Thank you very much. Thank you, YY, for the questions that you asked. I don't know if anyone has any other questions. There we go. I've got a question from G. Is there any possibility to see a photo of, or maybe childhood photo of the donor? If we're talking about anonymous egg donation, no, we're not permitted to either show you a photo or a childhood, a baby photo. But if you're talking about the eponymous egg donation processes that we offer through purchasing eggs through an egg bank, yes, you see clearly photographs in the websites of the egg banks. Thank you, G. I don't know if there's any other questions, remaining questions. I'm happy to reply to anything regarding egg donation or anything regarding treatment at NewLife in Greece, things that may be on your mind that may be troubling you, or things that you may want to ask. I'm all here to reply to anything. I'd also like to inform you, take this opportunity, that we will be coming to the UK. We'll be at the fertility show in London on the 17th, 18th of May. You'll be able to meet myself, one of my doctors, one of my gynecologists, and members of my staff, coordinators that will be with us. It'll be a great opportunity for you guys to come and meet us face to face, and also hear discussions live from a lot of scientists and sort of professionals from all over the world, but also from the UK, discussing about matters of egg donation, own egg treatments, and sort of maybe you'll be able to find the answers that you're seeking there as well and be better educated. You can buy tickets. I can see a question, CM. You can buy tickets online if you just type Fertility Show London. There's a really nice website, and you can see there's discussions by a lot of professionals, so you'll be able to purchase them directly from there. I've got a question by J.O. When you say there's not genetic testing, how will you be able to confirm the eggs are okay? Remember that I'm going to bring up the slide again from my presentation. If you see, these are the investigations that we perform on egg donors from anonymous egg donation, but also that are performed by the egg banks that we utilize for eponymous egg donation. As you see, part of their investigations are genetic testing. We perform a karyotype that investigates their chromosomes. We perform fragile X, cystic fibrosis, testing for spinal muscular atrophy, for non-syndromic deafness. Also, because the anonymous egg donation pool is Mediterranean origin, we do testing for beta thalassemia and sickle cell trait that are more prominent in Greece. Therefore, by performing all these tests, we minimize the risks that we have in creating genetically abnormal embryos down to the risks of random chromosomal abnormalities that are mainly associated with the female age. Donors that we recruit, according to the Greek legislation, should be under the age of 35. At NewLife, we only recruit donors under the age of 30. So you understand that the genetic abnormality rate in those age groups is very low, and we're estimating risks of around 20 to 23% maximum. And therefore, this is the reason why the Greek legislation tries to protect you and say that, you know, genetic testing isn't something that's recommended. It can be bypassed by simply performing further transfers, because remember that genetically abnormal embryos usually do not implant. If they do implant, they will usually lead to an early miscarriage. And hence why we're saying that it's not necessary to do PGTA testing on donor-derived embryos. I hope that answers your question, Jo. Any further questions? I hope that the presentation covered all the angles that may have been on your mind. Remember that when and if you individually contact us, my team, the people that will contact you, will start asking you questions about your history. I have a question. Let me get to this. AP, where is the best way to get funding for IVF treatment? When you're talking about funding, if you mean if there's specific agencies that you can get funding for, there are some, but not all of these will fund treatments abroad. You will need to speak to them individually and see if they're happy to provide funding for treatments abroad. One of these companies is called GAIA, G-A-I-A. They will be at the fertility show again. So it's something that potentially you can come and ask them live, but it's something that you need to discuss individually with them, because some of these companies only fund treatments within the UK. AP, I hope that answered your question. And I can see someone's typing a new question. What is the max age to implant embryo? I'm in the US, I'm in my 50s, I would like twins. As I said at the initial start of my presentation, treatments are allowed in Greece up until your 54th, 54 birthday. Over the age of 50, specific requirements are needed for us to follow. Patients need to visit a cardiologist, a breast specialist, a gynecologist to get an approval that they're fit and fine to go through treatment. These reports are provided to the Greek National Authority of Assisted Reproduction, which is the association that oversees all IVF clinics and licenses us. And once they approve treatment, we can proceed to treatment. It is something that we do a lot of the time. Sir J.O., if you'd like to contact us directly, we can explain more and see how we can assist you. We are currently having a lot of patients from the US. We understand the situation in the US is a lot more difficult than it is in Europe to seek treatment. So it is a market that we have been seeing that is growing over the years, not just for egg donation, for own egg treatments as well. As patients are starting to understand that treatments in Europe are more affordable, the legislation is a lot more patient-friendly, and people can have treatment. Now, on the point that you're making, I would like twins. This is something that would need to be discussed with the medical team, because as women age, you need to understand that the risks associated with twin pregnancies are higher. So they will review your personal medical history. They will scan you, and then they will be able to assist and let you know if a double embryo transfer is something that is suggested and permitted. I can see someone's typing a question. I'll wait for that to come up. I'm 57. Unfortunately, Jo, I'm not able to help because we're only permitted to perform treatments up to the age of 54. I'm not aware where you can seek treatment in Europe in this age group. I'm sorry, we cannot help you on that matter. I've got a question from C. What about the prices of single embryo donation with fresh embryos versus egg donation? Explained there are 7,300 for anonymous and 3,100 for eponymous. I'm trying to understand what you mean by single embryo donation. Let me bring up the pricing again so we can compare this together. This is the presentation that I made earlier. As I explained to you, in the anonymous fresh donor egg option, we offer two packages. These packages are either that we will guarantee the creation of 2 top quality blastocysts, or if we go to the advanced egg donation package, we will guarantee the creation of at least 4 top quality blastocysts. How these differ, they don't differ in better quality donors or worse quality donors. We allocate different numbers of eggs in order to guarantee these blastocysts. We know how our lab works, and hence why we can guarantee these numbers. With the eponymous frozen donor eggs, the guarantees are made by the egg banks. So when you go to purchase eggs, the specific egg bank will say, by purchasing 8 eggs, we guarantee this number of embryos. By purchasing 10 eggs, we guarantee these numbers of embryos. If for any reason these guarantees are not met, then the egg banks will ship in more eggs for you based on what you guys have signed and the individual packages that you've signed. But remember, on this cost, we need to add on the cost of how many eggs you buy and the shipping. Jo, you're asking a question. Could the embryos be created by you and sent to a clinic that could do the implantation? Jo, no, unfortunately, we're not permitted to create embryos in your age group. As you said earlier, you're 57. We're only permitted to create embryos for women up to the age of 54 and either do the transfer here, or if they are created before their 54th birthday, they can then ship the embryos to a clinic abroad if they permit such treatment. Mo, I've got a question. Is sperm donation allowed for both of these packages? Of course, of course. Sperm donation can be utilized for both these packages. We just, on top of these costs, we need to add the sperm donor that you purchase. Again, with sperm donation, we mainly work with three main sperm banks, the donor network, then we work with Chrysa International, and we work with the European Sperm Bank. All three of these sperm banks are very good. They offer both anonymous and eponymous sperm donors. You can select whichever sperm donor you wish. This is another big discussion that we have with patients when we start this process, so they understand how we're going to work, how we work with these sperm banks as well. As we're coming to the end of today's discussion, if there's any further questions, I'm happy to reply. Otherwise, I would like to give you a final piece of advice. Do your homework. Do your homework before you agree to treatment with any clinic. Make sure and ensure that you ask the correct questions. Ensure that the clinic has an organized department that speaks to you fast, efficiently, because now that you may be starting a process and you see a delay in a response, it may not be of a big importance, but when you're having treatment, and especially if something may go wrong, you need to understand that that you will have a reply very, very fast. Ensure that you ask the correct questions regarding if a specific clinic can treat patients from abroad. Do they have the proper organization? Do they have an international department? Do they cater for patients coming from the US? That the time differences are different. Always ask who will be treating me. Make sure that you don't just meet the marketing team, that you meet the doctor that will be treating you, the embryologist, the coordinators, because all of these people will make this journey an easier journey for you. Egg donation is offered in many, many countries, and within each country, they're offered by many, many clinics. Ensure that you understand the legislation. Ensure that you understand that the other patients that have had treatment in these specific clinics that you're seeking treatment at have been happy with the services, not just getting pregnant, but actually the services, because no one in the world, if they're a proper scientist, will say that we can guarantee 100% that you'll get pregnant with the first transfer. If someone does say that, please let me know. I'll send our patients there as well, because no one can achieve this. What we can do is make sure that we achieve the highest possible success rates with the highest safety measures. I hope that today's discussion has helped you guys, and that today's presentation has helped you understand who we are. I will write our website in the sort of comment section, so anyone that wishes to contact us can contact us. My team will take over. They will request investigations, your past history, and we will look at your history before sort of replying to you, scheduling a 1-hour free medical consultation where you'll meet the doctor that will be in charge of your case, and we will be able to give you individualized answers to your questions and queries. I thank you. Hopefully I will see you in London, as G says. I hope to see you guys at the fertility show, and hopefully I may see some of you here in Greece. Take care and good luck in your journey.